that's good.
Wow.
Some heavy legs, man.
Yeah.
Trunks. I know you had an accident. Tell me, do you remember some of the details that happened in your accident?
Yeah, well, the short version is a car had pulled out in front of me as I was going about between 35, 40 miles an hour and had a collision. I T-boned them, and it wasn't pleasant.
Mm-hmm, mm-hmm. Do you remember your seatbelt was on, and so do you remember airbags went off?
Seatbelt was on. No airbags, fortunately, because Takata airbag recall, so I could have been bad.
It's a good thing those weren't working.
Yeah.
Go ahead and stand up for me. I'm going to look at your posture again.
Uh-huh.
So just turn, there we go, perfect. Look straight forward. All right, so we got a little bit of head forward posture.
Mm-hmm.
Okay, look at your shoulders here. Okay, your right shoulder's a little high. All right. Hips are a little even, but just that right shoulder's really just, it's more that your neck is sort of avoiding that left side. You know, the right shoulder's high, but it's more that really the head tilts to the right, and then to make you won't walk around with your head tilted, so what happens is you drop your shoulder, does that make sense? To get your eyes level, we call it a righting reflex, and so your eyes are level, and it's really an avoidance of your left side of your neck. That's what's causing a head tilt, so we'll check that out in a second. May I have it on your back? Are you feeling any discomfort today?
No, not today.
Just okay. All right. Cross your arms for me. All right, bend both the knees for me. There we go. Little step for me. Take one deep breath in for me. Exhale. Breathe in deep for me. Exhale. Breathe in deep for me. Exhale. Chin down. All right, good. Okay, look over this shoulder as best you can. Deep breath in, and then exhale, twist. There we go. Other side for me. Breathe in deep. Exhale. All right, face up for me. Yeah, see, this left side's sticking out over here. Got to get that compressed. Let's start with that side. Let's start with the bigger misalignment. There we go. There we go. Breathe. There we go. Exhale. Yeah. There we go. All right. Yeah, we go. I got you. Come over this side, Carl. I'll see if I can. You're good. You almost can see it. That right there is the knot that I was seeing when you were standing. It's kind of a little bump right there. It's the muscle over top is tighter because the bone's not in the right place. So the muscles have gotten tighter to sort of stabilize everything. It's not the job of your muscles to give stability, but they can, in like a secondary function of a muscle is to give stability. So if the joint's in the wrong position, the muscles will sort of come to try to stabilize everything. And I feel like some people have taken that to an extreme of like, well, it's the job of all your muscles to give stability. You know, if we can just strengthen all your muscles, then you'll be more stable. And while that might be true, I go, gosh, you know how tight your muscles are now, how much lactic acid now is built up along the spine. That's good. So this might have been here before an accident, but it's an avoidance. Maybe this joint got injured during the whiplash, and then your head sort of tilts away from it to try to make it feel better. And then 10, 20 years down the road, when another part of your spine is overworked, that's when all of a sudden everybody starts to care. You know, we live in reactive care medicine world, not proactive preventative care. It's actually gone down quite a bit. You feel the difference? I mean, it's really, it's gone down pretty amazing. I mean, it's gotten pretty smooth. So this probably was from the accident in terms of, if it was like something from when you were in your childhood or your brother, it would still be here. You're saying it wouldn't change that quickly. It's like the newer the stain, the easier it is to get rid of it. If it's a stain that's been in the carpet for decades, it doesn't change very quickly.
Right.
Very good. No, it's like, it's almost completely smooth now. Very good. That's good. I watched a documentary. It was like mega factories or something on Lamborghini, and you know, they talk about the laser precision and guidance and the 0.1 micron this, you know, frame was built within such a, you know, very small tolerances. And then after they put the entire car together, they have a guy with gloves on run his hands along the car feeling for imperfections. And I go, that's crazy. You know, you can have a laser guided system, and then they check the car in all these different points, but then they have to have somebody run their hands over the car, and it really, to me, exemplifies how much you can feel. Does that make sense? Through your hands. You know, why would that be? To me, that would be a redundant job that they couldn't be replaced with, you know, with a machine, right? But there's something that even the car manufacturers realize that the palpatory sense, the kinetic, you know, feeling is better than the machine, and that just, I think, was a good example of that. And so, actually, sort of like that with that guy that, you know, is feeling for imperfections on the paint of the car or the body of the car. It's like I'm feeling with my thumb. I can feel any dents or dings in the spine, and just like your skin doesn't forget, any injuries internally, you know, they don't really ever go away. You probably could show me scars that you've got when you were a kid. You know, I can. You know, just, you know, your skin remembers. And so internally, when we have a whiplash, you know, the body doesn't heal with the same material, and so we're trying to reorganize it so that it is as close to the original material as possible, and so that you're not left with this shorter scar tissue that ends up stiffening you. That makes sense, and then making you tighter, and then your range of motion goes down. And there we go. Very good. So that's the arch. You've been doing your stretches, I can tell, because there's very little. I have people that I put into this position, and you'll see my arm you'll see my arm like shaking, because there's no resistance here, and that's a good sign that your body's able to go into this lordotic arch position and it not be the end of the world. Does that make sense? I mean, it's like, you know, I mean, I'm putting a lot of pressure on his neck, and, you know, your neck should be able to arch easily, not, you know, you're killing me. I'm just holding that. There we go. I'm going to check. See if we can get a little more. Just checking. There, a little piece. Let it go. Nice. There we go. That's that deeper adjustment. You notice it wasn't as loud. The bones went a bigger movement the first adjustment, and that final one was like the final closure of the joint. So by working on the soft tissue, we can, you know, get the joint a little bit more warmed up and, you know, flexible, so we can get that full closure. We're trying to get all the weight onto the joints of the spine, because the discs are on the front, the cartilage is on the front part of the spine, and that doesn't regenerate. So you should have someone check, you know, make sure that the joints can compress. That way the cartilage on the front is staying healthy and will last longer. Well, YouTube's gonna love that. There we go. Good. Yeah, we got it. There we go. Now I got your leg hold onto the table. Nice. All right. A little bit rounded forward. Just a little bit. Right one's a little bit more forward. Left one looks pretty good. Are you right-handed?
Yeah.
Yeah, the right shoulder's a little bit more rolled forward, so I'm gonna have you put your hand on your hip for me.
Okay.
Sort of like that. Just
like
hold that on there. And then put that right there. And so you're gonna press back a little bit into my elbow. So I'm gonna give you some resistance there.
Okay.
And then keep pressing back. There we go. Good. Just press back. There you go. There we go. Press back. It's good. That one wasn't misaligned as much as the other one. So. All right, left side, a little bit more raised over here. We're going to try to push this side down a little bit. There we go. Yeah, right there. There we go. Yeah, not as much over here. And then on the left side, a couple of tangles in here. There we go. What sports did you play in high school were you?
Basketball.
Basketball mainly?
Little flag football. And some very light soccer.
Uh-huh. How many years basketball?
Probably 4 or 5 years.
I gotcha. Pretty competitive or just casual or do you...
YMCA.
Okay. My brother did that also. Yeah, just trying to untangle that right there. And we'll try to, after we loosen it up a little bit, you'll let me sort of see if we can press it and get it back to home a little better. This area moving here saves the lower back, so the typically L4 and L5 are 99% of surgery, and no one talks about it. And I'm always amazed that there's no TV commercial.
Oops.
It's okay. That is not the ringtone that I expect.
It's just the default.
Okay, fair enough. So L4 and L5 have all the surgery, and there's no TV commercials to tell us that, there's a pattern that we're seeing, and that we're almost just waiting for those problems to happen, and no one's checking all the ones that are supposed to be working beforehand to prevent L5 from falling apart. So if the upper back is lined up properly and your middle back is moving, you won't be just left with L5, overtaxed. And this is your the sitting, and then being injured sitting almost changes where your body thinks center is. There's things called proprioceptors, which basically tell your cerebellum where you are in space, and when you get in an accident, all those sensors get zapped, kind of idea, and then your center gets rechanged, and almost like your blueprint changes where your body wants to be. And so that's why we have to bend back and then hold you there to try to undo all that sensory input that's bent you forward. Now we have to do the opposite stretches, and then sometimes we'll actually put you into bending back, and then we'll use a little tapping gun, does that make sense, to actually activate those proprioceptors. There we go. Yeah, right there. That needs to be loosened up. Gotta untangle that. That's good. After having my dad work on it, you're like, this is nothing, man. I can do this all day.
Exactly.
Not the bow man.
Except this is a little something. We tap out.
Oh, okay, all right.
No, it's good. The pain is good.
That's right. Kelly Clarkson had it wrong. What doesn't kill you makes you strong. I'm like, no. I take the Dark Knight approach, right?
What if you end up a paraplegic? Quadriplegic.
It's more like the Joker from Batman, right? What doesn't kill you makes you stranger. Yeah, that's better. I like that one better than Kelly Clarkson. No. Yeah, right there. Right there.
Yeah.
We'll come back to that in a minute. Not there, Ed. Anywhere but my hiding spot. Okay. Tend to lean away from things that hurt in the same way you tend to like avoid a room in your house that's messy. It's like I don't want to go in that room. It's all clutter or broken glass or damaged things, and so the only way to make it approachable is you first clean the area, make the area a nice place to be, right? And then you'll spend more time there. And so how do you get your posture to change? You have to make these areas not the end of the world and make it somewhere nice to be, and then your body will start residing more often in these areas. Posture is antalgia, and I kind of want the patient to turn around and look and confront. I usually say, give me an example of a problem that gets better by ignoring it. I'm sure maybe somebody will have an answer. I'm waiting. I want the. No, it gets better if you have this problem. It gets. I don't know. Maybe it's. Check engine light on my car? No problem. Black tape. My hand's on a stove and my hand's burning? Nah, painkiller. I don't have any pain anymore. So it's always more difficult to deal with your problems. IRS is contacting me and asking for. Throw that letter away. Whatever. So it's dealing with your problems instead of ignoring your problems. Just trying to get this shoulder blade here. Right there is where you. Real quick, right there. See if you can zoom in on that. Right there is. The more the shoulder goes forward, the more it expands open, and then makes the muscles work harder and harder. So the rhomboids get tighter and tighter. There we go. You okay? Mm-hmm. All right. Just trying to clean that out a little bit. There we go. Not the butt. Anything but the butt. So we're trying to loosen up. This is that SI joint. This is what we check when you're on your side. Mm-hmm. So make sure this joint is moving as best as it can. The sacroiliac joint takes a lot of the burden off your lower back. So sitting locks this joint. Running locks this joint. Playing basketball locks this joint. And then injuries tend to tighten up everything. And so I want your spine to age evenly, and the only way I see that being possible is by keeping all the parts working, right? Not letting anything. If there's an area that you go, Ed, get away from there. I go, no, that's what needs to be. That's what we have to go into. Excellent, excellent. All right, very good. Loosen this up before we do the other adjustment. There's a little bit. survive this treatment, life becomes easy. And then, heaven forbid, injuries happen to us, at least you're in a better position to receive an injury, right? If you have your whole spine working, you know, more parts of your back are, that makes sense, functioning to participate in the actual, you know, I'm going to go home and get in a car accident today, you know, whatever. You know, nobody's prepared for it, so the only way to be prepared is to have your spine in the best position possible. And I think we'd been working on you before the accident, right? Even before you had that accident.
Yeah.
We'd been working on you, so you know, that helps to keep it more minimal. You know, if you have a person that has no chiropractic care, I had two people one time, two 19-year-olds. They were sitting in light, 45 mile an hour, you know, rear end, and the girl had been adjusted her whole life. The boyfriend in the passenger seat never been adjusted before in his life, and the girl had like no symptoms. You know, they both received a 45 mile an hour rear end. The girl had no symptoms. The boyfriend couldn't hardly move. And you know, how can that be? They're both the same age. Well, when he was hit, all the force went into his lower neck, right? And when she was hit, because her whole spine was working, because she'd been adjusted since she was a baby, her whole spine participated. And you know, how do you value that? How do you value that if an injury happens, your body's, I'm going to say that the effect of that injury is going to be a lot smaller. It's not going to affect you in the long term as it would have if say, only a few parts of your spine. That make sense?
Yeah.
You know, and so chiropractic's not just about illness care, it's health care and preventative care and putting your spine, if you can survive this stress test, you know, if you can, most people, I have new patients come in here and I push on this joint and, help! I go, sorry, this shouldn't be the end of the world to have pressure put on your joints. And so if you can handle the roller on your hip joints, that means that these joints are functioning properly, and you know, they're on the football field playing. They're not sitting on the sidelines just watching the game going, life is good. So purpose of this adjustment is, remember, on this left side, we're going to try to push this down as I lift you up. And so we're going to work on trying to reduce that hump a little bit. Here we go. Breathe in for me. Exhale. Here we go. We're going to arch up. Here we go. Nice. Whoa. Nice. I think we got it all. Exhale. Good. Yeah, no. Hope that picked it up. Did you hear it?
I heard it.
All right, so this is the same thing, but I'm going to use your legs. So we're going to bring your arms, legs up.
Okay.
I'm going to breathe in for me. And then you're going to exhale for me. I got you, bud. We're going to stretch for a second. I got you. There we go. Exhale. Yeah, I got you. I know.
Yeah.
I got you. Breathe. You got to get used to it. All right, that's good. Wow. Some heavy legs, man.
Yeah.
I got you, brother. I'm just going to check this knee. We're opening up the meniscus.
I did. Oh, sweet. Okay.
So we're just trying to get some more
Yeah.
blood flow.
I like that.
So the meniscus almost has no blood flow unless you're actually bending the knee. The movement of the knee is what actually pumps blood into the meniscus. And so,
Like running or walking.
well, but even with running or walking, you're not really, how often are you going into a real, deep knee bend? Right, running or walking
So we're talking
might,
like climbing stairs?
no, you're like just
No?
stretching.
Wow, okay.
Yeah, I don't really you got to get to, a deep knee bend to really get that effective. I mean, there's some blood flow with partial bends, but really that deep knee bend gets a full, sort of whoosh of blood in there to rehydrate that meniscus. The meniscus is...
I do that all the time.
Mhm.
No, I sit.
Good.
I'll sit on my leg, just
Okay.
because I'm bored. Comfortable.
There we go. I got you. Nothing in your wrist, okay. That's good. It's like when they say in like a comedian, I got a leg 150. Yeah, I got a leg I got a leg 100. I was like 200-pound legs there. Jeez. I'm done. Nice.
How tall are you, Nathan?
6'4".
Okay, I was like, you definitely look taller than Ed, so that's not usual.
That's good.
Yeah.
Yeah, your body's much more. Yeah, gee whiz. I think that bow move just, your back was here, and it's hard to compress the joints.
Right.
And so part of what holds your head forward is that this becomes, I'm exaggerating a little bit, but this, you can't compress it. So after we take you, to here, now it's
And
like,
show your body, hey, you can do this.
you can bend
Yeah,
back and
yeah.
it'd be. And so now after we've gotten you here, you go home, stretch your body back, end of the day, retain the work. It's like an orthodontist. They give you a retainer to prevent your teeth from just going back. It's like, well, aren't my teeth going to get crooked again? Well, that's why you got to put this in your mouth. And so that's what the Denneroll, the roller, those are retainers to make your body stay there, and then the soft tissue work and the adjustments is to even just get you to be able to approach it. And so very good, Nathan.